Hello everyone and welcome to another day of high yield Usmle questions. Today we will be talking about infectious diseases. So a 28-year-old male patient presented with fever and a rash. 3 weeks ago he returned from a camping trip to Vermont. Examination shows bull's eye rash on the left thigh. Temperature is 101, so there is fever, blood pressure is normal, and pulse is normal. There is no history of drug allergies, which means that most likely this rash is not from any drugs. Also, there is no history that any drug was taken recently. So what is the next best step in management? So let's talk about the different options. So first is Lyme serology. So remember, this case looks definitely like a Lyme case, Lyme disease case, because there is fever, there is rash, and also the patient recently went to a Lyme endemic state, Vermont. So remember, New Jersey, New York, Massachusetts. So these are the states that, and also there are others like Wisconsin. You can see the map on Google where there are Lyme disease, because in the vignette they will usually give you those states where Lyme disease is endemic. So here it is Vermont. So also they gave you the classic bullseye rash. So you remember, whenever you see a bullseye rash, right, and there's like fever, rash, also arthralgias, and the patient came from a Lyme endemic region recently, so that is that is definitely Lyme's disease. And the thing is, if you don't get this rash, then you would do Lyme serology. But here the case is pretty clear. Like from a scenario, you can see that it is Lyme disease, so we don't need to do Lyme serology. Let's say if they were saying that the same scenario was present and they did not mention anything about the bullseye rash, and they mentioned other features of Lyme disease, like maybe facial palsy or maybe arthralgias, so then we can go with Lyme serology to kind of so that we can confirm the diagnosis. But here the diagnosis is already confirmed from examination. They gave you the classic rash, and from the patient came from Lyme endemic region. So then we have the doxycycline therapy. So this would be the answer here. So doxycycline is used for Lyme disease. Remember, Lyme is a systemic infection, so you get a lot of disorders depending on which phase of the Lyme disease the patient is in. So you can get meningitis, you can get carditis. Those features the patient can get. And doxycycline has a really good systemic penetration, so that's why this is the first line treatment for Lyme disease. Then with the blood cultures, remember here blood culture will have no role, because the patient is vitally stable. There is just fever, but the patient does not have any hypotension or tachycardia that would suggest SIRS or sepsis. So when you have those like SIRS and sepsis criteria, like pulse greater than 90 and there is hypotension, blood pressure less than 90, systolic blood pressure less than 90, so those will be the criteria for blood cultures. Here it won't have any role. Amoxicillin, remember, is also used for Lyme disease, but one of the things to know is that amoxicillin is used if doxycycline cannot be used. So what are the conditions where doxycycline cannot be used? So doxycycline, avoid in pregnancy. So if they say in the vignette that the patient is pregnant, avoid it, because it can cause fetal bone abnormalities, and it can also cause fetal teeth staining. Also avoid in children less than 7 years, because it can also cause like the teeth staining there as well. So avoid in these two scenarios. So in those cases you can use amoxicillin. Here doxycycline is the right answer, because the patient is not in the vignette is a 28-year-old male. It's there's no pregnancy in the vignette. There's no like the patient is not less than 7 years old. So then we have azithromycin. Azithromycin is not typically used for Lyme disease, so that will also be not the right answer. So remember, whenever you have like a typical scenario, they give you this bull's eye rash, just directly go with and the patient came from Lyme endemic region, directly go with treatment. If they don't give you this, but there is the scenario is still typical, but there is no rash, then go with Lyme serology. So hope this video was helpful, and if you liked it, kindly like and subscribe the channel. And if anyone requires tutoring, they can email me here. And if this video helps you in your prep, consider donating to the channel or supporting the channel. Link in the description here. Thank you for watching.